Hello, everybody, and welcome to our virtual coffee with an OSCE educator. My name is Sarah Grant. I'm the Managing Director of My Healthcare Recruit and owner of OSCE Accelerator. I'm joined today by the lovely Beth Fincato. Beth is an OSCE educator. She's been teaching OSCE for over 5 years now at a local NHS trust. She has supported literally thousands of nurses through the OSCE exam, and she is here today to share some of her wealth of wisdom with us. So today, because we get lots of questions on our social media, we really wanted to dive into some more of our clinical skills in a bit more detail to answer some of those questions that you've got. And today's topic is IM, or intramuscular injection. So Beth, thank you so much for joining us to chat about this. Can you tell us, what can an international nurse expect when they approach the intramuscular injection station?
Thanks. So hi Sarah, and welcome everyone. So for this station, obviously you're going to have to give an IM injection. It's going to be to a mannequin. So they will have some kind of like injection pad, which is just like a fake bit of skin where you're going to do the injection on the mannequin. The examiner should direct you to where the pad is. So normally the scenario you'll get, I haven't had any nurses having a different scenario, but things can always change, is that you're a district nurse, you need to go to the patient's own home and give them a vitamin B12 injection.
Got you. And how long have candidates got to complete this station?
So this station is 12 minutes.
12 minutes, okay, so a bit longer than some of the others. It's a little bit more complex. Can you tell me what is vitamin B12 and what our nurses need to know about it?
So I would say, if you don't know what it is, if you're not familiar with this drug, please look it up before the exam, because you don't want to be panicking at that time. Also, they will have the BNF available for you to look it up if you can't remember, but 12 minutes isn't long, so best if you know it before. So vitamin B12, or the other name for it, is hydroxybalamine. Excuse my pronunciation.
A bit of a mouthful.
Yeah. So it's often used to treat anemia and vitamin B12 deficiency. So we quite often use that in some of our elderly patients.
Got you. And what sort of equipment would you expect to be faced with, asked to use as part of this station?
So they will supply you with a range of needles. So some of them might not be the correct ones. So remember, you will need to use a drawing up needle to prepare it. And then obviously your administering needle should be 21 gauge. We commonly have green or blue needles for this in the UK. You'll also be provided with, it will look like a saline flush, which will be sort of labelled as your medication, and you'll be told to pretend that's the medication. Be careful if the examiner advises you that it's glass, or if it is glass. Normally it's plastic and they tell you it's glass. You need to open it as if it is glass with your gauze and just pretend it is glass.
Got you. And is there any documentation required for this station?
So you'll just have a drug chart to complete. It's quite simple. It's just one page.
Wonderful. And so you're an international nurse, you're approaching this station. How would you recommend preparing it for it?
So as always, you need to be familiar with how we give the injection. So it needs to be at a 90-degree angle. You need to stretch the skin. You need to leave 1 centimetre out, and then you need to hold the needle in after you've administered it for 10 seconds.
Wonderful. And would you say that there's any particularly common mistakes or common fails at this station?
So often not signing the drug chart. I would always recommend double checking any paperwork you have if you have extra time at the end of the station to try and prevent these errors. Incorrect disposal of sharps, so be careful. We're not meant to resheath the needle after using it. As you know, some of our needles have like a clip kind of thing on the end, so you can sort of press it against a table or something to resheath it and then put in the sharp spin. But just put straight in the sharp spin is easier. Incorrect injection technique, so definitely I would look up the correct injection technique according to the marking criteria, because it might be slightly different to what you're normally doing in practice. And sometimes the candidates get confused between the subcut and IM injections also.
So just making sure that you're super clear on the differences between the two.
Yeah.
Goes back to that marking criteria where I think you've suggested that as far as possible you try to almost memorize that marking criteria, so it's almost like that step-by-step instruction.
Yeah, if you know the marking criteria, you know what you need to do to pass, essentially. So I would study it. If you know it, you know what to do to pass.
Fabulous. And then final question then, any top tips that you would give to international nurses in order to help them go into this station feeling super confident and ready to pass?
So practice as much as you can. Get a timer, get a friend to be the patient or the examiner, and just practice. Even better if you've got someone else who's also taking OSCE, you can practice together and help each other.
Smashing. So a lot of peer support there.
Yeah.
Wonderful. Well, thank you so much for giving us that insight. That was super helpful. We really, really appreciate your tips and tricks, Beth. So thank you for joining us, and we'll speak with you again next time.
Thank you.
Thank you. Bye now.
Bye.
Bye.